All right. Well, I'm all nice and relaxed, so I hope everyone else is, to talk about bone health this evening. Thank you for all coming out, and hope that you have been enjoying your time so far. As this says here, I am one of the family medicine physicians at Lakeshore Health Partners in Zeeland. So come out and visit us if you're in need of a primary care doctor. So we'll take good care of you. So they gave me 15 minutes to talk about bone health. And I said, oh my gosh, how am I supposed to do that in 15 minutes? Because this could easily be hours and hours of lecture. So I'm really just gonna touch on the surface, mostly what is osteoporosis, what are your risk factors, and how can you modify those risk factors and move forward to prevent damages to your bones. So I'm not gonna go into treatment at all, talk about anything like that, more so just focusing on risk factors and prevention. So a little bit of background, osteoporosis, what that means is porous bone. Our bones are, if you could imagine, a honeycomb. So our bones have holes in them, so to speak, okay? And as we age, the natural progression, which you may have heard is called osteopenia, is your bone density decreases. And that's natural as we age. So our bone density peaks, and then it declines kind of around the age of 40. And so our goal is to prevent rapid decline of that, or sooner decline. And so with that being said, as the bone loss happens, those holes or that honeycomb becomes bigger, more brittle, and more easily to break. And sometimes a fracture is our first sign of osteoporosis. And so we don't want that to happen. I don't want anybody to fracture and find out they have osteoporosis. We want to prevent it. So that's why we're here tonight to talk about it. And also because it's a big deal. 54 million people have low bone density or osteoporosis. That is a huge number. 1 in 2 women and up to 1 in 4 men over the age of 50 will break a bone due to osteoporosis. So we've got to do something better. This is costing our healthcare system over $19 billion, okay? So it's huge cost, and it's something that we can prevent. So that's why we're here tonight to talk about it. So up there listed are some risk factors. The first 2 are really our most modifiable risk factors, meaning something that we can change in our lifestyle. So current smokers are at higher risk of fracture or developing osteoporosis. So if you are a smoker, quitting smoking is going to be to your benefit. Now, if you have a history of smoking, that puts you at a slightly increased risk. But again, obviously, a current smoker is at much higher risk. Excess alcohol intake, tonight not included, but they consider excessive alcohol more than 2 drinks per day. And if that is your case, you're at increased risk, particularly for hip fracture. So really, you know, when it comes to everything, when I talk to my patients about, you know, oh, I can't drink, I can't do this, it's everything in moderation, okay? That's what it really comes down to. And so with the alcohol, no more than 2 drinks per day is the recommendation with that. Certain medications, some of this we can't change because sometimes we need to be on medications, but that should be something that you have that discussion with your doctor, because a lot of times patients get put on medications in the hospital or urgent care or ER, and it just kind of follows through, and they come in for a visit and, oh, why are you taking this? Well, I don't know. They told me to. Well, do you really need to be on that medication? So having that discussion of what is the shortest amount of time I can be on this medication. So particular medications that can cause increased risk into your bones or increased risk for osteoporosis are steroids. So prednisone is the most common one we think of, and that is more so if it's 5 milligrams a day for longer than a 3-month period. And that doesn't have to be consecutive, so that can be cumulative. So again, we have some patients that have different forms of arthritis, COPD, that are getting this chronically. This increases your risk, and you should be screened for osteoporosis sooner. Certain seizure medications increase your risk for osteoporosis, as well as our aromatase inhibitors. So those are medications that decrease estrogen, and estrogen is bone protective. So we think of that a lot in our breast cancer patients and breast cancer survivors if they've been on those medications. And our hematologists, oncologists are really good about bone health and screening early and giving the appropriate treatment for that. And then some other ones that you may not think about that a lot of people take are PPIs, which are your Prilosec, your Nexiums, your Previcids, and that's one commonly that people are just on and they don't even know why. So again, having that discussion for the shortest amount of time that you need to be on that medication. And then certain antidepressants, such as Zoloft, Prozac, Lexapro, can also potentially increase your risk for osteoporosis. Again, advancing age, obviously, as we talked about in the graph there, shows you that your bone mass peaks and then naturally declines. So we want to keep that progression along the curve, and we don't want it to be more rapid. So advancing age, unfortunately, we can't change that. Maybe Dr. Nyes can come up with a way that we can slow the progression of aging, but I'm not sure that's going to happen. Low body mass index, there has been some thought on that as bones being smaller, so more likely to fracture. Previous history of a fragility fracture, which is when you were to break a wrist or a hip. So if you've had that, that is by definition osteoporosis, and you're at increased risk for future fractures. And then if you've had a parent who's ever fractured a hip, that puts you at increased risk for osteoporosis. So a lot of things that maybe you didn't necessarily think of. We think of the most common things, but thinking a parent who fractured a hip, you might not necessarily know that that's a risk factor for you. Certain medical conditions can increase your risk, and you should be screened earlier. Just a few, this is not an all-inclusive list. There are multiple chronic medical conditions, but rheumatoid arthritis, celiac disease, Crohn's disease, those are the most common ones that we think about. And then low vitamin D and calcium, which we're going to talk about in a minute. So we know what it is. We know what puts us at risk. Now we have to know what we can do to prevent it. So again, the most common things you can do are the preventable or modifiable things is quit smoking if you're a smoker, and limit your alcohol to no more than 2 drinks a day or evening is the recommendation there. So I mentioned on the last slide the vitamin deficiencies, so calcium and vitamin D. So that's what I'm going to focus on, kind of my last few minutes that I have here on this. So the recommendation for anyone, well, I guess let me back up first, sorry. So for screening purposes, the recommendation is that anyone ages 65 and over should be screened for osteoporosis with a bone density test, or more commonly known as a DEXA scan. So some of you may have had that already or have heard about that, but the general population should be screened 65 and older. However, if you have one of the risk factors that we talked about previously and you're over the age of 50, then you should be screened sooner. You should not wait until 65 because you have that risk factor that increases your risk to have that natural decline happen quicker, and we want to catch that early, okay? So again, talking to your physician about a DEXA or bone density test is really important. So calcium and vitamin D. The vitamin D is the easier one. The calcium can sometimes get a little tricky. So a lot of patients tell me, you know, hey, I eat a really good diet. I eat a lot of cheese or I eat a lot of yogurt. You know, is that enough calcium? So anyone 50 and over should have 1,200 milligrams of calcium in their diet for bone health, and 50 and younger is about 1,000. Now the average person with a normal varied diet will get anywhere from 400 to 600 milligrams of calcium in your diet. To get 1,200 milligrams of calcium in your diet, you would have to eat 6 cups of Greek yogurt a day or drink 4 8-ounce glasses of milk a day. So most people don't do that. And so really keeping a food diary or journal to be able to track what your calcium is. In my last slide, when we wrap up here, we'll have a website, and there are calcium calculators where you can put in what your diet consists of, and it will help to average out how much calcium you're getting in your diet. So whatever you're not getting in your diet needs to be supplemented. So there are 2 different types of calcium. There's calcium carbonate and calcium citrate. So I Guarantee most of you have no idea what type of calcium you're taking, so go home and look at your pill bottles and your supplements. Calcium carbonate is one that needs to be taken with food because it needs the acid in the stomach to be absorbed. So that one can be tricky because we're busy, we're on the go, so sometimes you're taking your things whenever you can get a chance. So I recommend calcium citrate. That can be taken with or without a meal, and also can be used in individuals who are on those PPIs, Prilosec, Nexium, Pepcid, Prevacid, Zantac. So if you're on any of those chronic medications for reflux or GERD, you should be taking calcium citrate, okay? Vitamin D, so for bone health, the recommendation over the age of 50 is 800 to 1,000 international units of vitamin D3 a day, and under 50 is 400 to 800. The problem is, as most of us and everyone in this room is vitamin D deficient, and so we're already behind the 8 ball. So we need to replace, and then we need to get our normal bone health dose on top of that. So it is really hard to get toxic or overdose on vitamin D. With the exception of today, we usually live in gloomy, gray, cloudy Michigan, so we're not getting a lot of vitamin D. So I tell all my patients as a rule, 2,000 of vitamin D3 a day. And again, you have to look at your pill bottles because I have a lot of women taking a multivitamin, a calcitrate, so a calcium and D, and then extra D. And we add it all up, and again, it's not horribly dangerous to you to be on extra vitamin D, but a lot of women don't realize that they're already taking what they need to, if not more. Most women's multivitamins have 800 to 1,000 of D3 in it. Oh, looks like there's a boat behind us. I see everyone smiling and pointing, hoping it wasn't something on me. So again, looking at your pill bottles and making sure you know what you're taking, okay? Some people ask me, I'm out in the sun all the time in the summer. Isn't that enough to get my vitamin D? Well, I hate to break it to you. You should be wearing sunscreen to prevent skin cancer and skin aging. And if you're wearing anything with an SPF of 8 or greater, you're blocking over 95% of vitamin D. So we need to supplement. And in getting vitamin D from the sun too, it depends on your age, your skin pigment, your ethnicity, the latitude, the time of the day, the season. So all these factors come into play. And again, who is going to figure all that out? Vitamin D is good for you. It's an antioxidant. It's cancer preventative. It's bone health. So you won't get it from the sun. Sorry, that's just how it is. So vitamin D helps the absorption of calcium, but they don't necessarily need to be taken together. So that's important to know as well. And then briefly, because I'm running over, I knew this was going to happen. I got 2 more minutes here, I think, or maybe I got the 5. Did I get the 5 already? Am I way over? I don't know. No one's telling me, so I'm just gonna kind of go with it. So we talked about the calcium and vitamin D. Controlling chronic medical conditions, so that would be if you're a diabetic, making sure that you have good blood sugar control, working with your specialist to control if you have, inflammatory bowel disease or rheumatoid arthritis. And then talking to your doctors about your medications. Hey, I'm on this. Should I be on this? What should I do for my bones? Weight-bearing exercises, which Kathleen is going to talk to us about in a moment and demonstrate some exercises. So weight-bearing does not have to be high impact. Weight-bearing is walking. So if you walk for 15 minutes a day, that is weight-bearing activity and is improving your bone health. And then obviously there's other strengthening exercises too, and that's what Kathleen's gonna go over with us in a moment and demonstrate to us. So this is the National Osteoporosis Foundation website, and I would encourage you all to visit that. It is wonderful. There is tons of good patient information on there, lots of helpful, how much calcium is in my food. There's calcium calculators that I was talking about, so you can put in a typical day's diet and see how much calcium you're getting. And it goes over pretty much everything that I talked about, the amounts of calcium, vitamin D. So that is the 15-minute version of bone health. And obviously we're gonna have the panel in a few moments to answer any questions that you have. But now I'm gonna turn it over to Kathleen so she can get us up and moving.
And the National Osteoporosis Foundation website also has great information about all the stuff I'm gonna give you. So about strengthening, about weight-bearing exercise, recommendations for each of those things. How many minutes do you need a week? How many days a week of strength training? So they have pamphlets. It's great. So, all right. So weight-bearing tasks, as Dr. Sumner said, do not necessarily have to be big jumping down, up and down exercises. It can be walking the dog, hiking, going up and down steps, ballroom dancing, pickleball, tennis, anything where your feet are getting impact through the ground. Because the cool thing about our bodies is it adjusts to the demands that we place on it, right? So if we demand that we put force through our bones, your body will lay down more bone and it will be less porous. So that's why weight-bearing exercise is so important. The recommendation is 150 minutes a week. So you can split that however you like. It sounds like more than it is when you split it between 7 days. But there's also other exercises too to think about that are, because these all seem kind of like cardiovascular exercises too. So there's things to consider like swimming that are still a great strengthening exercise and cardiovascular exercise, but not a weight-bearing exercise. So maybe not your go-to if you are working toward better bone health. So a big thing that we think about with osteoporosis is fragility fractures, right? Those fractures of the wrists, of the hip, of the pelvis that happen when somebody falls from just the height of standing. And a big component of reducing risk of fractures is don't fall down. So your balance is really important. Setting up your environment, removing area rugs if you know you have impaired balance, using those assistive devices, you know, and working with your physical therapist on deciding what is the right amount of assistance for you versus what is the right amount of freedom for you to move about safely without falling. So I'd love for everyone to stand up and try some balance exercises with me. As you guys can see on the screen here, there's this gal who has a very narrow base of support. So the more narrow our base of support is, the more challenged our balance is. So let's just start with putting our feet as close as they can get together. And some of us might be challenged by that. And so if you're not, cross your arms across your chest. And I'm a little unstable. So if you're not, close your eyes and see if you can maintain your balance. So there's a little sway in your balance system, hopefully. Your ankles are adjusting, hopefully not your hips. Go ahead and open your eyes. The second picture here is of a gal doing a tandem stance. So all that alcohol, we're gonna do a little test, a little test. And the easy version of this is to put one foot in front of the other, but don't line them up yet. So just try right foot in front of left foot or vice versa and see what it feels like to be there. Now I will say that most people are a little dominant with one foot and I bet you all chose it. So let's try the other foot now. One foot in front of the other. And we're not putting them directly in front yet. Excellent. I'm super into cop shows, so I'm thrilled to say now I want you all to put your feet right in front of each other and I want to see who falls down. You're not driving home. It's really hard. And what's even harder, go back to your regular stance, what's even harder is this is a Tai Chi move, but the idea of very slowly removing your weight from one leg. So we all know like standing on one leg is kind of hard, but you can a little bit use momentum to like get your leg up there, stand for a second and put it back down. But it's so impressive, right, when those Cirque du Soleil people like really slowly lift their foot up and put it forward. So that's what I want you to try. Is peel one foot up off the ground, ounce by ounce, and see if you can keep it up in the air and then maintain your balance. And then set it down and try it with the other foot. Ah. And if all of this is way too easy for you, I encourage you to go to your gym and find some unstable surfaces. Stand on Bosu balls, right? Like those blue half balls with the black side. Do some standing, single leg deadlifts, but throw your balance into your regular strengthening routine. That way you don't have to spend extra time on it. You can just kind of incorporate it and prevent some falling. So another really big component of fitness in having osteoporosis or osteopenia, the components are weight-bearing exercise, right? Because we want to build bone health. We want to have good balance so that we're not falling down. We also want to have nice posture, right? And so we talked about wrist fractures and we talked about hip fractures, but there's also spinal fractures where you might fracture through the vertebra in your spine. And what can happen over time is it can change the shape of your spine. And so you can see these different women on a course of changing spines. Look at this woman later. She has a very forward pelvis. She has a very forward head. It puts a lot of pressure on her neck. She has a very short front body, very short pecs, very short abs, but a very long, weak back. And so there's an inverse relationship between how strong your back muscles are and how forward you bend at your back. That is, the stronger your back muscles, the less bend you have forward at your spine with osteoporosis. And so the muscles that end up keeping you upright are your back muscles. So I'd love for you all to grab your bands, and we're going to try a couple things in standing here. Okay, great. So what I'd love everybody to do is left hand down at their hip, right arm up at their shoulder. So we're making a sash across our bodies, and we're all doing left hand down, right hand up. That way we don't hit each other. And you're going to bring your right arm up above and squeeze your shoulder blade down and back. And we're going to do 8 of those. All right? 2, 3. Lovely. You want to keep nice tall body, straight spine. Squeezing your shoulder blade down and back so your shoulder blade muscles are the ones getting developed here. Lovely. It's kind of hard, right? Let's switch. So how about right hand down at our sides, left hand at your shoulder, and up we go. Lovely. This is like a really intense game of Simon Says. I kind of love that you're all like doing exactly what I say. It's kind of fun. Okay, the next one you get to sit for, so go ahead and have a seat. These are all kind of at-home versions of exercises you could also find at the gym, or you could find in exercise videos. And what I'd like you all to do now is loop the band along one foot so you've made a little pulley system. And get it good and under there. I don't want it snapping back at you now. And I'm going to do a little loop with my hands so it's in my hands well. And we're going to do a row, and again, to build up those scapular muscles. So you are going to pull your elbows back and then let them come forward nice and slow. Pull them back. Good. 3, 4. Stick your chest out. Lovely. Last one. Good. All right, ladies. Because our backs get weak and the front of us gets short, another component to good posture when you have osteoporosis is keeping long in front, right? So having a stretchy abdomen and a stretchy chest. So one more stretch to try. I want you to grasp your hands behind your back if you're able. If you're not able, you're just going to put them on the sides of your chair. And you're going to look up at the sky, stick your belly out, stick your chest out, squeeze your shoulder blades back and together, and make yourself long through the front of you. It feels lovely, doesn't it? And 30 seconds is the amount of time you want to hold a stretch. Older tissues, maybe 60 seconds. Good, so we'll do 10 more seconds. And let go. All right, just one more component here is I didn't want to leave out that when there are some things that you want to do, there are lots of great ways to move. There are just a couple of ways to avoid moving if you have already had fractures in your spine. And that is that we don't want you bending at your spine, like so, or twisting. So this is about the worst maneuver that you could do, because it's a bend and a twist. But that increases your risk of fracturing, and especially if you load it. So don't be lifting up laundry baskets with a bent spine if you have spinal fractures already. But overall, there's many more ways that are great for you to move than there are ways that are dangerous for you to move. And the most important thing is to find an exercise routine that you're going to do. So if that's pickleball, that's pickleball. And if that's weightlifting with a little bit of walking with your dog, that's awesome too. Whatever works. Very good. I think Dr. Berkholz is going to take us through the panel discussion.